Hello and welcome to my weekly video blog, and today on Ava Ogle Talks Menopause I'm going to be talking about more surprising problems in the menopause. If you like my tips and advice, then please subscribe and remember to hit the bell icon so you can be notified of all my new videos. I've talked a lot in the past about surprising symptoms and other problems that suddenly appear in the menopause, and women are wanting to know, is this part of the menopause? Is it anything to do with the menopause? What's going on here? So I thought today I would look at more that women have contacted me about, where they're not quite sure if it's related at all or whether something else completely is going on. So number one is tendinitis. Now, your tendons are that kind of like almost like stretchy ropes or a bit like rubber bands, and they're attached one end to your muscle and the other end to the bone. So these tendons help the joints to move and flex. They give you your range of movement. So all the time I'm moving my arm, the muscles and bones between them, the tendons are moving, they're stretching and they're contracting. But what can happen during the menopause is we know that low estrogen can affect the tendons. So the tendons can tighten, they can dry out, so they become a lot stiffer. So that ease of movement suddenly stops. The tendons can then become inflamed, which will make any kind of movement painful. You will get inflammation, you will get heat to the joint. You may find that even simple tasks, you think of the number of sort of tendons in your hands if you're typing, if you're walking, if you're doing any kind of movement, and the tendons get irritated and inflamed and dehydrated, it's going to cause a huge amount of discomfort and pain. So what needs to be done here is treat the inflammation. So if you're getting a lot of heat, you would look at herbs such as devil's claw, which is known as a natural anti-inflammatory. Loads of water. It's really important to take water every day to stop that dryness and dehydration from occurring. And it's amazing how many women have come back and said that that's really helped very quickly to ease the pain and discomfort. As long as it's not too advanced, you could look at a supplement called glucosamine sulfate. This is known to help to strengthen tendons and also ligaments, but it's quite a slow one, so you may not see any improvements for maybe 2 to 3 months. The other thing that may help here is acupuncture. It can be very helpful, especially for alleviating pain. It is really important here to keep your movement up. I know if things get really sore, but if you stop the movement completely, then the muscles can then tighten as well, and you can end up doubling the problem. So it's important to keep active, but only to the point where you're not causing extra pain and discomfort. Number two is hemorrhoids, or the common name for these is piles. These can be extremely uncomfortable. It's basically bleeding from the rectum. For some women, the piles can actually pop out, which means you're not going to be able to sit very comfortably at all. So in this situation, it can be a number of causes. We know that blood vessels can weaken just generally due to falling estrogen. It could be due to the dryness in the digestive tract. That our digestive tract is one of the mucous membranes of the body. And we know that falling estrogen can affect mucous membranes. So your digestive tract and the bowel can become a little bit less moisturized, if you like, and that can affect the blood vessels in that area. Constipation is a really common factor here, purely because you're just straining the whole time, and that will put extra pressure on these blood vessels, and that can then result in your hemorrhoids. It can also be due, and I have spoken about this recently, is problems with the pelvic girdle. If you get something called a prolapse, then the uterus, the bladder and the bowel, they can all slightly change position, and that can then put added pressure on the blood vessels in that area, and that can result in hemorrhoids. So for this one, really important, loads of water, treat the constipation, add extra fibre or take just a very gentle laxative to get things moving again. Vitamin C can be really helpful at strengthening blood vessels. So especially, and very often, there can be a link between varicose veins and hemorrhoids. So if you're also started to get varicose veins, then things like vitamin C can be very helpful. The herb horse chestnut is known to help with hemorrhoids and also varicose veins. If you feel that other areas are drying out, so if you're getting vaginal dryness, if you're getting dry skin, dry eyes, dry mouth, then there is the possibility that the digestive tract is affected as well, and you could take the supplement called sea buckthorn oil. Number 3 is dry lips. This was one of mine, and it was so weird. Just suddenly through the menopause, I ended up with dry lips. I didn't have dry anything else, but dry lips, which is really, really annoying. Again, this whole area, your lips, your mouth, your tongue, your throat, they are mucous membranes, so these can dry out due to falling estrogen. And if you think about it, your lips are on the outside, so they're going to be affected by the temperature in the room or the temperature outside. So very often in the winter, when you're in central heating, they get worse. If you're outside in the sun or the wind, they will get worse as well. So this again can be due to dehydration. It could also be due to the type of lipsticks you're using. If you're using lipsticks where there's loads of chemicals in them, some lip balms are full of nasties as well. So with this one, obviously loads of water. Look at the products you're putting on your lips. Go for organic lipsticks and organic lip balms and lip creams too. You can also get the sea buckthorn oil either as a capsule to take internally. You can get the oil and you can just apply that neat several times a day just to help to keep the dryness away. So I hope you found this one helpful. If you've had any of these conditions, if there are things that you've done to help yourself, please share them. There are so many women out there who are really struggling and could do with help. So until then, I look forward to seeing you next week for another edition of A. Vogel Talks Menopause.